Meeting is being recorded. I'm going to share my screen now as people join us. Oh, hold on.
Are we on yet?
Yes, we are.
Okay.
Just looking to share my screen. Hold on. Getting ourselves started. Just going to be starting in just a moment. There we go. Again, share our screen. Here we go. Very good. As people join us, here we go. Very good. You should be seeing my screen now.
We do.
Very good. And I can see that participants are joining us. All right, we now have quite a few participants. They're coming on. We will start in just a moment. I'd like to welcome everybody. Thank you, panelists, for being here. As people join, give folks just another moment to join us. Wonderful. We have quite a few people signed up to join us today. We want to give them just a moment to all get on. Folks are jumping on, as I can see. Very good. Okay, thank you, panelists, for being with us today. I'd like to welcome everybody to the IHLA webinar series, Health Literacy Response to COVID-19. Wonderful. We have participants from all over the world joining us. We have panelists from all over the world joining us. All right, people are still joining. We'll give folks just another moment. Again, welcome to the IHLA webinar series, Health Literacy Response to COVID-19. Everyone should see my slide, introductory slide, as we wait for folks to join. This webinar is being recorded.
There is a question, Sabrina, from Kimberly Hume. Are our lines all muted? Participants
lines are all muted. Yes, please to participate and to interact with our panelists. Please do. Oh, great! I see that. Please do type in questions or comments in the chat box. I see folks have been saying hello, welcome, hi everyone. Who's joining and where are you from? That's from Christine. Yes, I'm going to be asking everyone to share. Name, organization, and country, if you wouldn't mind, as you're joining. And please share with us in the chat box.
Should they make sure to turn it to all panelists and attendees in the chat box so that everyone sees it?
Yes, I believe
That's
so.
not default.
Okay, all panelists and attendees in the chat box. The other way to share questions is through the question and answer box, and that is where Kimberly has shared her question. Are all lines on mute? And yes, they are all on mute at the moment. Wonderful. People are sharing right now where they're from. Puerto Rico, I see. Wow, Canada. North Carolina, Tel Aviv, Cincinnati, USA. Wonderful. Great. All over. Portugal, Albuquerque, New Mexico. Very good. The UK. Excellent. Welcome. All right, I think we should get started. Someone from Malta also joining us. All right, very good. All righty, we are going to get started now. Okay, I'd like to welcome everybody here to the International Health Literacy Association's webinar series on health literacy response to COVID-19. Never before has the need for health literacy been so critical. Thank you so much for joining us today, and throughout this series you will hear from leading international health literacy experts to discuss the global impact of COVID-19 pandemic and to offer health literacy solutions. The International Health Literacy Association is a nonprofit member-based professional association dedicated to the development of our members in the field. The association is broadly inclusive of people promoting health literacy all around the world, and the association is run by and for members. All right, I'd like to begin in memory of all those who have lost their lives to COVID-19 and to recognize June 19th today, which is known as Juneteenth, commemorating the end of slavery in the United States. With what is going on in the US and globally, recognizing injustices and seeing this very much played out in terms of health disparities in COVID-19, we'd like to begin with just a moment of silence. Thank you all very much. My name is Sabrina Kurtz-Rossi, and I'm an associate professor at Tufts University School of Medicine. I'm also Secretary General of the International Health Literacy Association, and I'll be your moderator today. This webinar will last 1 hour. We will begin with introductions. We will then hear from our guest speakers. I will introduce them in just a moment. We will hold questions, open discussion to the end. Everyone is invited to ask questions throughout the webinar, through the question and answer box, as well as through our chat box. Please do introduce yourselves. I'm talking to all the participants. Again, in the chat box, if you wouldn't mind sharing your name, your organization, and what country you are from. We'll then end with more information, thanking our partners, as well as giving you information about our future webinars. Okay, with this, I'd like to move on to introducing our panelists to you. We will begin with hearing from Christine Sorensen. Christine is the president of she's founder and president of Global Health Literacy Academy. She's also founding president of the International Health Literacy Association. With heart and mind, she is engaged in global matters on health literacy, capacity building, strategy, and policy development. We will also hear from Araceli Rosales. She's chief content expert and multilingual director of Health Literacy Innovations. She's also on our membership committee of the International Health Literacy Association. She is widely known for her expertise in cross-cultural health communication, bringing accessible information and health education to diverse communities. Christine Sorensen will give us background and talk about the pandemic and health literacy and the global response. Araceli Rosales will talk about solutions to using health literacy solutions for clear communication during the pandemic. Julie McKinney, you will also hear from Julie McKinney. She is Director of Product Content and a Health Literacy Specialist for Exceptional Lives. She's also the moderator of the Health Literacy Discussion List on the IHLA Health Literacy Solutions Center. Thank you, Julie, for incredible moderation and leadership in that area. Her health literacy passion includes sharing resources, networking, and building partnerships between health agencies, adult literacy programs, and other partners. With that, I would like to turn it over to Christine Sorensen. I believe everyone is able to see us here, the panelists and myself. Christine, if you wouldn't mind sharing your screen, that would be great.
Yeah, and can you see it now? With the front talking about the global perspective?
Yes, Christine, I can see
And
it.
I'm really grateful and happy and proud that we are now launching a webinar series on the health literacy response to the COVID-19. As you know, health literacy is new for many, and for some of us, we have been engaged over many years. But let me just put some emphasis on what we're talking about. We do regard health literacy as a key determinant of health and well-being, and it can be understood as the combination of personal competencies and situational resources needed for people to access, understand, appraise, and use information and services to make decisions about their health. Hence, it includes the capacity to communicate, assert, and act upon these decisions. And there are several definitions out there, and I choose this one, which we developed in the International Union of Health Promotion Global Working Group on Health Literacy in the last years. And I do think that this particular definition captures both the individual response and the response of the environment, our systems, and our services, which I will be talking about later on. I would also like to highlight that health literacy is content and context specific, and this is Professor Don Notbeam who said or explained it in this way, that when we talk about health literacy, it's related to the content that we talk about. For example, diabetes literacy or cancer literacy, or in terms of the context. So it could be health literacy in schools or in hospitals or among a certain target group, children, elderly, and so forth. And depending on this content and context, the specific aspects of health literacy might differ. Notbeam also highlighted that we can look at health literacy from three perspectives: functional, interactive, and critical health literacy, where functional health literacy is very much about getting access to information, knowledge, and capacities to understand health information. So it could be a leaflet, it could be a website, and then also interactive health literacy, where we're able to engage on our health with health professionals, with social workers, with our families, the hairdresser, or whom it might concern. And then lastly, critical health literacy, which is very much about understanding that health is not only a personal issue, but also a public health issue. And this was particularly clear in the COVID and here during the pandemic. So why do we think this is so important? Why are we now putting all our hearts and souls into trying to bridge the gap? It's because it has a negative impact if you have weak health literacy. It's associated with less healthy choices, risky behavior, less self-management, you're often being hospitalized. And we also do see a significantly drain of human and financial resources in the health system, but also at individual basis if you're not getting the service or the treatment that you need in a timely manner. So in turn, investment in health literacy can help saving time, cost, and lives. And this was said by the one of the highest civil servants in the US healthcare system. Saving time, saving costs, and save lives. So health literacy helps us to strengthen empowerment. We can also talk about it as making the perfect match between people's skills and the complexity of the systems. And this was the model that was proposed by Ruth Parker and Scott Rudson 10 years ago. And we of course know that things are evolving, and in recent years we've focused more and more on people-centered health, and therefore it's also time to turn around the equation and add this perspective of us being the system healthcare providers, healthcare professionals, people working in social systems, that we need to adapt attitudes, adapt our skills to actually match people's complexity, because people may have more things at hand, and in many cases they are thrown around in silos in the way we have designed our healthcare system. But now it's time that we turn it around and that we design our services so that they match people's complexity. And in order to do so, I have a model here from Ministry of Health in New Zealand, And they have called to action to create health-led organizations that focus on people's abilities or patients' abilities to access and navigate the system. They call on responsibility of leadership and management, to engage all users and to educate the workforce and really try to target the services to meet the real needs of the population. And communication is an underlying capacity for achieving results and create this health-led organization. We know there are many models out there, and you probably know also the 10 attributes of healthcare organizations, which is based on the American Healthcare Society from about 10 years ago. So there is lots to do. But what we did see 4 or 5 months ago was that health literacy is really an underestimated problem. And this was also mentioned in the Lancet by some of our European colleagues, Orkan Okan and Lena Pakkari recently. And they highlighted that, well, for people, it's a challenge to access, understand, appraise, and apply information to make decisions and take actions regarding the spread of the coronavirus, because we know from our research that 1/3 or more than half in some countries have problems with weak health literacy. And on the other hand, it was really clear to us that authorities had to act really quickly, and they were challenged to make information accessible, understandable, appraisable, and applicable to match these new needs. And we all know, I think we have really been busy building the plane while flying, because we just didn't understand what we were up against. Now we know a bit more, but there are still so many unanswered questions. So the fact that we have a silent epidemic already from scratch with weak health literacy, we also were faced with another challenge, which was the infodemic. And already in the first months of the pandemic, 361 million videos were uploaded on YouTube, classified as related to COVID-19. And 19,000, and probably even more at this stage, were published on Google Scholar. And just on Twitter, 550 million tweets included the terms coronavirus, and COVID-19 and so forth. So no wonder that we are kind of overwhelmed with information on the pandemic. And at the same time, we have the World Health Organization calling to action, saying, well, everyone should have access to the right information at the right time in the right format. And this is really critical for us to beat the coronavirus. So in the light of this pandemic, we can really talk about health literacy as a matter of social responsibility and solidarity at all levels. It's not only about people and patients and individuals keeping physical distance, washing hands. It's also about politicians taking decisions about opening or closing border, opening and closing societal institutions, about researchers facing the trouble of doing research in real time, where we really need the results fast, and therefore maybe also bend the rules about ethical considerations. It's about a private sector joining a public sector to provide tools and masks and so forth. We are really talking about health literacy coming into action in all sectors of life, being a matter of social responsibility and solidarity at all levels. But we also do know, when you read the newspaper, that we are still not really there, and that in many countries, authorities have had difficulties in catching up. We have politicians taking unethical decisions on behalf of populations, and we have had people who are just free riding, trying to escape all the rules and regulations we're on. So we do have a big challenge ahead of us still. So it's a moment of truth. We try to rise to the occasion. And therefore, I'm also so happy and proud that we have a really vibrant worldwide health literacy community who really is driven to rise to this global challenge and really believe in empowerment of citizens, empowerment of governments, empowerment of social services in order to still strive for health equity. And we do know that our colleagues around the world are working around the clock to try to beat the coronavirus. We know that some of them have passed away. We know that some of them have suffered from the virus themselves, and they keep going. So this webinar is so timely. I'm so happy that we can share some of our experiences on this important matter. So this is what I hope you will take away from this webinar, is that even under these hard conditions, even under pressure, we should still strive to match, to make the perfect match and give people what they need, as you can see in this picture, where before it was one size fits all. We should still try to give people exactly what they need and ask them to also drive then the vehicle themselves in order to move forward. Thank you. This was all from me from now. And I will stop sharing.
Thank you so much, Christine. I'd like to now hand it over to Araceli Rosales, if you would like to share your screen. I do see some questions in the chat box. Again, we're going to have an open discussion with all of our panelists following their brief presentations.
Okay, can you tell me if you see my PowerPoint presentation?
Let me see. I do see a no, I don't think so.
Okay, hold on.
Do we see your PowerPoint presentation as of yet?
Okay.
Oh, I think so. Yes, there we go.
Okay, so hold on one moment.
Yes, put it on.
And thank you for joining us. My name is Araceli
Slideshow.
Rosales again. Can you hear me well?
Yes,
I work
Araceli.
for Health Literacy Innovations, the creators of the Health Literacy Advisor software program to check the health literacy of documents. And here are my objectives. Hold on.
Araceli, would you put, there you go. Great, thank you so much.
And I have a disclaimer. The samples that are used here are for education purpose only, and the sources and names of their authors are not listed on purpose. And I'm going to be talking about the infodemic and infopandemic. And the definition for this term is a rapid spread of information among a large number of people and in a given population, and that it really flies in a short period of time. It is misinformation of facts. It's fraud, abuse, and it also creates a lot of confusion. In social media, it goes viral, and unfortunately, false information is tweeted more than the actual correct information. And what is even sad is that the least discussed topics in the tweets and social media are the topics about public health risk and prevention of COVID. And again, this is what the purpose of information should be, but it's not. So raise your hands if you think that this is happening in your area.
All right, folks should be able to see the button and raise their hand. Oh, yes.
Yeah, you can see it. So I guess we can continue talking about this issue because it's important also for all of you. The World Health Organization team believes that the countermeasure for misinformation is simply to tell the truth. Hold on. So when we do this, of course, we are improving COVID-19 health literacy. In other words, informing people of what they need to do and how to protect themselves and stay safe. So here is our take on how to discredit COVID-19 infopandemia. And I will talk a little more in detail about this in my next slides. And I'm also wanting to tell you that I'm going to rush to my slides because there is so much to tell you about tips and how to actually make information good when it comes to such a new topic like COVID-19. So you're going to get a handout and you will be getting all of the slides anyway. So spotting misinformation. There is a lot out there, but ask your audience what they have heard. What is it that they are getting? What is it that is wrong? Select only those topics that need clarification and that are important to your target audience. For example, in this list of myths that we all have heard about, which ones will you select and explain? Just take a minute to read them. Well, if you say the first three, you're correct. The other two are really not relevant. So you have to be selective, and this will help you to keep the information brief and to the point. Check the science. And there is a lot of information also out there asking people to spot fake news. But people with low health literacy skills, do they know what a source is? Do they really know who CDC and who is? Do they read articles? Can they tell if it's true or is not? And in reality, when it comes to such a new topic, not even us good readers can tell nowadays what's true and what is not. So do not ask people to evaluate the information. I always say, do the homework for them, give them the facts. Address audience's needs, feelings, and emotions. Remember that what is important to us may not be important to them. Let them tell you what they need, what they want to learn, and also how much they already know on the topic, and fill in the gaps. Explain misinformation. And question and answer format and myth and true format are good formats to do this. And again, there is already a lot out there so that you can use. Provide accurate and needed information in a way that people can understand and act on it. People with low literacy skills trust health professionals, family members, community leaders. So sometimes the information out there and the known sources and official sources to us are not for them. So think about that and perhaps make yourself accessible and available. And here is an example. Have questions about COVID-19? We have the answers. But just tell them to ask you. People with low literacy skills sometimes rely on oral information and want to talk about their issues, the problems, and their questions. When talking about being inclusive, again, there is a lot of information out there, but the bottom line is you really need to know your audience. You need to know who you want to target. And you also need to find out what's needed, what groups or languages are not served. Do special groups have what they need? Is information already developed in the topics that are important in certain formats, such as Braille and big print, and people with certain disabilities, etc. So make what's needed and rely on what is already done and don't reinvent the wheel. And that way we also save resources. Also, COVID-19 is such a complicated issue and the information is changing constantly. So it really requires us to make constant updates and change the information. Sometimes this seems to be hard because of lack of resources and time. So find what's already done, evaluate it, and adapt it. By all means, again, do not reinvent the wheel, and this way you will save resources. Create your own social media. This seems to be the medium of communication nowadays for certain populations. So when you do, identify yourselves, the people that's the truth, what you're talking about is real, the truth, and evidence-based. And of course, if they know you, they will believe you. Be realistic. One message doesn't apply to everybody. So for the 2.2 billion people in the world that have no water and soap, washing their hands is not an option. So they need other options. So think about these issues and what are some of their concerns of your target audience. Know your audience, where they're coming from, what they're suffering, why is this happening? And of course, we already know, as Christine mentioned, many of them have low levels of literacy. So again, write your content, adapt it, then translate it. And by all means, test it with the audience. So for example, this piece over here, who is this for? And as you can see, an effort has been made to show that this is a piece for a diverse group of people. So if you are creating a piece that you want this piece to be inclusive, by all means, show it in your illustrations, show it in your content. Take it to your audience again and test it. Now, this is a true story. We need to think about our audience, and this is an example of how can we do it. This is my gardener this week. He told us that he got flu-like symptoms, all of them, and he had to stay in bed for 3 weeks. Didn't know anything about COVID. Didn't look for help or testing. Didn't quarantine himself. But look at his profile. He's a non-reader, he's a Spanish speaker, he has no health insurance, he's not connected to the internet, and had to work through the pandemic. So when asked if he thought that he had coronavirus, he looked puzzled and said, the flu? So all that information about COVID out there missed him, or he missed the information. What happened here? So ask people with low literacy how much they know and what they want to know. Information needs to be relevant, believable, accessible, and actionable. So in order to make it relevant, one good tip is to use testimonials and stories to help make it personal, interesting, and help people take action. And here is a homework for you. Create a story for my gardener so that he learned about COVID and the important issues that he needs to. Some other tips are check for plain language, check your text for health literacy, suitability, and reading level. And I will be biased not to mention here our tool, who is a very comprehensive tool, but simply look at what you're getting, what you're writing. Social distance and shortness of breath are jargon terms. Plain language, we still see text justified to the right, not to the left. Passive voice being used, and what it looks easy to read sometimes is not, or can be evaluated and simplified further. Some other tips, limit amount of information that is numeric and graphs. Think and ask yourself, are they really needed? And of course, when you check for understanding, check for cultural issues, words used, language, and illustrations. And believe it or not, are people getting the message? Here are some samples of what it looks easy to read. But again, when we tested this in previous pieces, people missed the don't. And what they got is only the text at the bottom, which is actually the don'ts, and they took it as something they have to do. So here is a technique of how to solve that problem by actually including the don't and the action or verb word. Test your pictures. Oh, please, by all means do. What is that? People take things literally, sometimes say things like the face of the lady is missing. Believe me, this is happening all the time. So what may be clear to you may not be clear to them. Segmenting the information, try to keep information between 5 and 7 points. Again, this is also happening a lot because we think we don't have time to develop several pieces, but sometimes it's a matter of just breaking subjects, making headings and subheadings. Clear design. Here are some tips. Is this easy to read? We see this a lot. This is called reverse text, and it's very hard to read. And of course, what does clear design look like? It looks like this, a good contrast in between the background and the font. Make information actionable. Think about what you want people to do, the behaviors. Do they understand the consequences of not adopting the behavior or taking the risk? Use verbs. Tell people where to call and where to go. Make information accessible. How they are getting the information. And people with low literacy skills use more, again, as I said, oral information. So sometimes TV, sometimes they don't have internet. So the best thing is just to ask them, how do they want the information? Think of my gardener. And here are some tips for online communication, and I'm not going to go over all of them because of lack of time, but of course, you're going to get the handout. And we have a lot more that we can discuss in our questions and answers time.
Thank you, Araceli.
Do I still have time to go over this?
Yeah, well, do you have a little bit, one more minute, and then we really do need to give Julie her time and we can open it up at the end.
Okay.
Do you want to wait or do you want to go over it?
Let me very briefly, this is really important, at least the top. People with low literacy may feel uncomfortable using internet and video conferencing. They are shy and are concerned about showing their space. So please do not assume that they are just going to use telemedicine and use video. Sometimes they feel a lot more comfortable with phone, and make sure you also consent and allow family members and relatives or friends to be present. Sometimes they rely on them for taking care of themselves.
Thank you so much, Araceli, and we can continue that discussion. That's a great segue to talk to Julie McKinney, who's going to share available resources with us. So first of all, thank you, Christine Sorensen, for your previous presentation. Thank you, Araceli, and now we're going to hand it over to Julie McKinney, who's going to share resources with us. And then we do have some very good questions coming in through both the chat box and through the question and answer box. And we will get to those in just a moment. Julie, are you able to share your screen?
Yes, yes, I am. Hang on a second, I'll do this and this, share, and
We've got some excellent questions coming in that we will open up in just a moment. I think, Araceli, you just raised a very important one in terms of using the internet. And that was excellent, talking about how to discern correct information and misinformation. Julie, are you ready to go?
I'm ready. Can you see my screen?
No, not yet. I don't see it. Araceli, do you see it, Christine?
Yes.
Yes, you do.
Yes.
Okay,
Yes,
great.
Okay.
Great. All righty.
Okay. Okay, so hi everybody. I'm going to try to be quick here so that we have time for questions. And I want to talk about resources, and I'm not going to obviously show you everything, but I want to show you just a few places where you can find a lot of information and where you can search for what you need. So it might be interesting. You don't have to, but if you want to just throw in the chat box, just what kinds of resources you're searching for, what you would be looking for to help educate your communities about COVID-19. And then I'm going to take you through some sites. So Sabrina, I don't know if we're doing the polls, but I I was wondering how many people on this list were members of the health literacy discussion list. It's an international health literacy listserv that's been going for a long time. And I hope that people, oh, here's Sabrina put a poll up here. So if you're a member of the list, please answer, and I'm going to show you about it. But what the list is, it's an email list that includes a community of over 1,600 health literacy advocates from around the world. It might seem like there's most of them from the U.S. It's supported by the Institute for Healthcare Advancement, IHLA, but we'd love to get more international people on it. So
we've got half and half of the group.
Okay, all right,
Very
that's great.
interesting.
That's great.
Okay,
well,
go ahead, Julie.
Please join, because the discussion list itself is a really good source of resources. If you're looking for something, you can just ask, say, hey, I'm looking for this in this language or whatever, and people come out of the woodwork and share things. The Health Literacy Solution Center from IHA is sort of a place where the list is housed, although it's really just an email list too, but you can find the nuggets from it that gets shared on the list end up in the library on the Health Literacy Solution Center site. So I'm just going to walk you through this really quickly. This is the home page, and then if you scroll down, you'll see there's sections on COVID-19 resources. And if you click that green bottom at the button, that will take you to our list of COVID resources. I'll show you that in a minute, but we've been collecting them, from around the world and categorizing them, and I'll show you that. If you go down to this second green button down at the bottom here, that's where you can join the health literacy discussion list. It's called the main health literacy community on this. And so we would love to have people join that. If you, and just a reminder, you will get these slides, and I believe the webinar will be recorded as well and available on the IHLA site. So the discussion list, just quickly, you can get to the list of recent threads. You can go back for a long time. Oops, sorry, this is, and so, we asked several questions about coronavirus and COVID-19 resources early on, and people wrote back with lists of their with lists of their resources. So we'll put a call out and people answer, and then we've taken all of the resources that people answered for COVID-19 and put that into our COVID-19 resource page. And so this has different categories. Their resources, it's divided into resources for professionals and then ones for the general public. And then the general public is broken down to communicating to adults, children, seniors, and then there's the overview and mental health. So this is a good place to look for resources if you're looking for something specific. And then it comes with a list here. Also note that you can create a new entry. We'd love it if you guys have good resources that you want to add to this collection. It's sort of a crowdsourcing thing. We would like you to enter that, and so that we can have this as a place where we can have good health literate resources about COVID-19 housed. And then, I just want to quickly go through a few other ones places where you can get information. There's the WHO site. You can get good information at. The U.S., this is our CDC, the Centers for Disease Control coronavirus page. In your country, if you're going to lead people to a page, make sure that it's one that has easier to read information, one that has, a good health literate design and information in it. Not all government sites here in the US anyway are like that, so I don't always send people to it, but the CDC has a very good health literacy background and puts out good, easy to read stuff. And then there's some from other organizations about certain topics. The Georgia State put out the coronavirus adult health literacy resources. So they searched for resources that were very easy to read, and they put them into this place here. So that's another one. COVID-19 Health Literacy Project from Harvard University collected resources in I think 35 different languages. Here we go. So you can get fact sheets in different languages there. That's a good source for multilingual information. Exceptional Lives pulled together resources for families dealing with kids with disabilities, and they have resources that are accessible in different ways and activities to hang out with your kids during this stay-at-home time. There's also really easy to read resources for people with disabilities who really need to communicate just with pictures. There's a lot of good stuff here, and I just wanted to say one thing about Christine said that we're learning to fly the plane while we're building the plane while we're flying with it. I just wanted to acknowledge that the health literacy plane has been being built for a while, and I can see that the structure that field and that effort has created has built a plane that responded to this COVID situation really nicely. As soon as it came out, I was seeing health literate, easy to read, well-designed information coming out all over the place. I mean, certainly take Araceli's point that you have to look and you have to test with your audience, but I just want to thank the health literacy community for building a plane and infrastructure that really helped respond to this situation very nicely. So thank you.
Well, thank you so much, Julie McKinney. So thank you, Christine Sorensen, again, for helping us recognize health literacy as a tool for managing this pandemic and mobilizing the global health literacy community. Thank you, Araceli Rosales, for defining the problem and what is infodemic and helping us to identify, writing and design solutions that work or for communicating information. And Julie McKinney, thank you for helping us find available resources for the public and also health professionals that we can all that are accessible and available to be used. So now we want to turn to opening it up for questions. We've gotten some very interesting questions. A lot of questions are related to, and this is for full panelists. How do we build trust when this is one question, how do we build trust when the information is constantly evolving, but also when there is so much mistrust? I think that encapsulates a number of the questions. Christine, would you like to begin?
I can start. I think one fact is that we need to get used to uncertainty. And of course, what many of us want is certainty and that we are in control. But empowerment is also about managing our health and well-being and lives in times of uncertainty. And we know from the last evolvement of technologies and so forth, the innovations are moving so fast. Unfortunately, the healthcare system is one of the most conservative, so we don't always see the benefits there, but it is moving very fast, and those who are really quickly can adapt, they will do better. So really, literacy is not about reading and writing, it's about learning, de-learning, and relearning. So that's what I would like to highlight as a critical skill now.
Great, thank you. There was also a question specifically about YouTube videos that are misleading. So we have a lot of information that's, not true. What do we think about, what do we tell people who are spreading misinformation? And what do we do about these YouTube videos that are misleading? Araceli, would you like to answer?
Yes, actually, I do get that question from people a lot and also from my family. And my answer to that is stop. Stop looking at information that may confuse you, that makes you afraid, that makes you concerned. Concentrate and focus on the information that keeps you healthy, that keeps you safe, that keeps you that you can do things for yourself and your family and others around you. And I'm a true believer of only reading what I need. And I you know, I just tell everybody, stop.
Yeah. Very good. Thank you. There question, Julie, do you want to respond to this question before I move to the next one?
Just a quick thing about the
Yes.
question about trust. How do we engender
Yes.
trust? And I think Araceli brought up a really good point in her section about, you know, the message has to come from someone people trust. So if you're not that person or that organization, collaborate with one who people do trust and work through them, or community leaders. So that's a way to get around that.
Okay, Julie, here's a question for you. What can you do if you're looking for something specific but you can't find it?
Yes, so yeah, of course that's going to happen. And what I always tell people is post a question to the health literacy discussion list and say, hey, I'm looking for this. I can't find it. And you know, you'll have 1,600 people, many of whom are actually engaged and will look around, and if they can find it, they will reply. So that's my best answer to that, because it really is a generous collaborative group of people on the list. So
thank you. And here's a question for Dr. Sorensen. What do you mean when you say health literacy is a political choice? And I do see there's another question about politicians that are not setting good examples. Yeah. So can you explain that a little bit for us?
Yeah, I'm on a mission trying to make politicians and decision makers health literate as well. I do see some putting budgets before health and well-being. And I do think we have a responsibility to also make them aware of the consequences. We also talk about health in all governments, and some of them are really not aware of the consequences that they make. Some do not want to be aware of what impact they do. So my best answer is to vote, 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 and choose your politicians carefully, and hope that your friends and families and communities will do the same.
Thank you. Araceli, here's a question for you. Are there differences in plain language principles across languages?
This is a very good question. And so in some languages that are already very simple, the rule is to stick to some of the plain language principles in terms of a shortness of sentences, using less words, explaining medical terms and jargon that is used in every language. And of course, when translating, translators sometimes who do not know about plain language, you know, go back to using the medical terminology and combining sentences. So train your translators. And the best, again, way to know whether people understand the information is give it to them to read and see if they are getting the message and they're getting the point.
All right, thank you so much. There is another question specifically about mask wearing. Are there resources that you can share that encourage people to wear masks, or other ways that you can suggest that we help to encourage people to wear masks?
I did see one. I'm sorry, Julie, I don't know if you know, but I saw a handout, and I have the link, and actually I can post it, that have instructions on what to do with your mask, how to wear it well, how to even clean it. So there are resources.
And this is a very specific question, I think, to the challenges that the US is having right now. Less of a challenge.
Yeah. I'd also say to look in the Health Literacy Special Collections COVID-19 resources. There's a bunch of stuff in there about mask wearing. And, you know,
okay.
So maybe I have a question there, because I'm based in Denmark and our authorities do not recommend to wear masks. It's they haven't seen the evidence working for it. So of course that is also trying to be health literate to evaluate information. But I think also at the point in time, our risk has not been as high that we have really been forced to use masks as prevention and protection. But it's very, very interesting to live in a country where the authorities are not still recommending masks.
Yeah, that's interesting.
And that does get to the earlier question around the evolving science and the evolving information.
But
that is,
also, I do tell
yes, Araceli.
people that question that, and I say, well, you know what? You do what you think is best for you, and I know I want to protect myself and my family. So if I have the maybe here and the no here, I'm going to go with the maybe. And if wearing the mask will maybe keep me safe, I'm going to go with that. So that's what I tell people. You know, you just kind of balance and make decisions based on what is good for you.
I also want to just there were a couple questions about whether the slides and the recordings will be made available. And yes, the answer is yes, they will be made available. You'll be able to see those on the International Health Literacy Association's website. And you will also be hearing from us after this webinar with specifically with questions, evaluation questions, and we will be sharing the information. So I'm going to just wrap things up now to say that I'd like to encourage, let folks know that we do have the Global Health Literacy Summit due to the COVID-19 was postponed, and we have a new date that will take place October 3 to 5 in 2021. We want to especially thank our partners, IHLA Healthcare Group and ISO University. And so please do join us. I also want to invite all of our attendees today to become an IHLA member. If you're not an IHLA member as of yet, it is free. And you can find that also on the i-hla.org website. I want to thank our other partners for supporting and being with the International Health Literacy Association to put this webinar series on, including IHLA Healthcare Group and ISO University, Exceptional Lives, Department of Health Education Promotion and Khalit Health Services in Israel, University of Haifa in Israel, Health Literacy Innovations, the IHA Center for Health Literacy Solutions, and Tufts University School of Medicine that's providing us with this platform. Please do join us for the webinar number 2, which will take place on the July 20th at 7 GMT. Registration again will come out on www.i-hla.org. I want to thank again our panelists so much for all that you had to offer, and also for our many participants from all over the world that have joined us today. Each of you, would you like to make a closing remark before we sign off? Dr. Sorensen, would you like to make a closing remark?
Yeah, thank you very much to all attendees today, and I have followed the chat with all your questions. I'm extremely happy for us now to share the information, encourage you to join the Health Literacy list, to join the International Health Literacy Association, so that we can become a global voice and try to waken up all our decision makers to help our colleagues who are struggling out there in the field and have to rush developing materials and treatments and so forth, that we are there to help them too, not only the citizen patients and communities, but also our colleagues. We're here for you and with you.
Thank you. Julie McKinney, would you like to say a word?
Yes, yeah, thank you. Yeah, Christine put it nicely about coming together as a community. And I guess I just want to say, I'm just really, you know, proud and behind the health literacy community. And I hope that more people can join the community and engage with us, and that we can work together globally. We have so much to learn from people in other countries and across the globe. And sometimes, you know, we always talk about silos. We don't want that to happen here. So I'm really glad to see so many different countries joining this call. And I hope that you'll join the association and the list, and that we can collaborate as we go forward. Thank you.
Wonderful. And Araceli Rosales, one last comment, please.
Yes, thank you for helping us to be here today, but I do have a last comment, and that is that everybody in the world have the right to have information that they can understand and act on it. And to me, that is being equal, providing equality, inclusion, and paying attention to diversity, and focusing in reaching out to those that have the need for that information, because there is already information for all of us that can read and can have access to it.
Wonderful. Thank you all very much. Thank you for a global community. It is really an honor and a pleasure and a really great learning experience to have so many colleagues from all over the world working to improve health literacy for all. Thank you all. This concludes our first webinar in the IHLA Health Literacy webinar COVID-19 series.
Bye-bye.
Bye.